Hi, it's time to talk. I'm Dr. Bessie McCann, and I own and operate Derma Medical Spa in Washington State. And today we're talking about Botox for newbies. So this covers also Dysport, Daxxify, Xeomin. There's a lot of different brands of the same type of medicine. I'm going to call it all Botox for the ease of having conversation about it, but just know that this applies to all of them, actually. So the way Botox works, it's several little tiny pokes. I'm actually going to grab one of our little needles that we use for this, since I'm sitting at my treatment area. So this is a needle that we would use for doing Botox. And you can see that this is just like the itty bittiest little tiny, crazy tiny little needle. It's so small. It's like, yeah, itty bitty, very hard to see. So lots of little pokes. I'll just use the frown area as an example. So like poke, 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 poke. That would be like treating the frown lines. Right after those little pokes, like during the treatment, you will see a little bump, a little red bump at each one of those pokes. And that is just from the trauma of a little needle poke in the skin. That bump goes away in like 10 to 15 minutes. You won't see it by the time you're driving out of the parking lot. And then you don't really see anything right away. So Botox takes some days to start kicking in. Dysport kicks in just slightly faster. Daxxify also kicks in faster, but in general, it's going to be 3 to 5 days before you start to see anything. And the effect keeps kicking in slowly over the course of 2 weeks. So at 2 weeks, it has fully kicked in. That's what you're going to see. And that effect then lasts for 3 to 4 months for most of them. I feel like Xeomin, it's not quite as long. Daxxify for a lot of people can be longer. Dysport can be longer. For some people, Botox is longer. It's very individual. Then you come back every 3 or 4 months or however long it lasts for you, and we do the same thing again. What you will notice, like if we're talking about the frown lines, say you get 2 big lines right here, and say you've been making those lines for years and years. And now, even when you're totally still, those lines are still there. They have been like carved into the skin. What you'll notice when we first do Botox is that they don't disappear. They do get lighter, they get less deep, more shallow. They're softer, but they don't disappear right away. And that's because the skin is like imprinted with them. And if you're patient and continue to do Botox, you'll see those continue to fade over time. And if you want them like gone sooner, then there are other treatments we can do to help the skin repair in those little spots. For most people, like in their 20s, 30s, even early 40s sometimes, even if those lines are kind of imprinted in there, if we stop encouraging them by doing Botox, they will fade completely and they'll go to being smooth. So it's really just a matter of how much of a hurry you're in to get rid of those lines. So lastly, I'm going to tell you really quick where we put Botox. And there's a lot of variation to this, but in my office, this is what we do. So we do frown lines. We do forehead lines, so like the horizontal lines here. We do a little extra right here for a brow lift. That just helps this part of the brow like lift just a little bit more. But honestly, this is the brow lift. I feel like this is going to be a whole other conversation. You know what? I'm going to keep you in a little bit of suspense. Those are just the first few spots that we go. I'm going to make a whole nother talk about all the other places. Okay. Thanks for chatting.